Welcome once again to SoCo Chat, a podcast where we hear directly from county leaders, discuss the latest news, and talk about all things concerning our beautiful corner of California known as Sonoma County. Welcome back to SoCo Chat. I'm your host once again, Paul Gullickson, Communications Manager for the County of Sonoma, and we thank you for being with us. Well, we are in the midst of airborne virus season, which ranks right up there with tax season, I think, is in terms of everybody's least favorite time of the year. And this year, experts are telling us of a quademic of winter viruses, which is we have influenza, COVID-19, RSV, and norovirus, all of which are increasing at the same time. Add to that the risk of bird flu, and we have a real doozy of a public health situation on our hands. And to help us wade through all of that and answer our health questions today is Dr. Karen Smith, Sonoma County's health officer. But before we get to our interview with Dr. Smith, I need to start with our trivia question, as always. Our question today is this: in what year was the first influenza vaccine developed? And I'm going to give you a multiple choice. Was it 1925, 1931, or 1937? If you know, call us at 707-565-2242 or email us at publicaffairs, that's one word, at sonoma-county.org. And if you're correct, you'll win a SoCo Chat coffee mug as well as a gift card for a mug of coffee or perhaps a cup of tea at Pete's Coffee. If you're like me, you love to drink tea, not coffee, when you're fighting a cold. I'm healthy. My family has gotten over some of our own illnesses. I don't know if we had a full-blown flu, but there was something nasty going through our house in January. We're all healthy now, so I'm glad to be here. And Dr. Smith, we're very glad to have you. Thank you for being with us.
My pleasure to be here.
Have you been healthy this winter?
I have. I did have a respiratory infection in December, but it was after some travel, and it could have just been I was exhausted.
What's your hidden secret about staying healthy?
I actually still mask in really crowded places like
smart.
Airports, that sort of thing. And I drink a lot of water, especially if I'm traveling.
Yeah,
that helps a lot.
That really helps.
Yeah.
Okay, good. Thank you for those tips.
Mm-hmm.
Okay, so we're reading that the country, including Sonoma County, is in the midst of a surge in flu cases, right? And in fact, more people, this is interesting, more people have died this winter from the flu than from COVID-19, which is really a first since the outbreak of COVID in 2019.
That's right, yeah.
Yeah. So what's going on? Tell us what's the status of things, particularly here in Sonoma County.
Yeah, Sonoma's looking a lot like the rest of the country right now. In fact, in some ways, we're better off. I'll start with flu because that's actually really the big actor this year. And we had a, sort of a typical really fast rise in influenza, which we see every year. Usually we see a sort of slow taper off. This year it rose, it started to taper. We're all going, oh, wow, it's been short. And then it took off again. And so that second peak is actually higher than we've seen in decades. And on top of that, and this is for us, the most concerning thing is that the number of severe cases is much higher than we've seen in a long time. We're not, unfortunate with influenza. We're never quite sure why. We know this; it's cyclic. But one of the things that we are seeing, so there's two strains of human influenza A in circulation, H1 and H3. Nothing you need to remember, but. Right. Often when that happens, we'll see a little bit more accumulation. Okay. And it's sometimes the influenza vaccine isn't as good a match. And so more people will get sick.
Okay.
And when more people get sick, then you'll also see more people who get severely ill,
right.
Which tends to be the people who are most vulnerable, elderly people with disabilities, that sort of thing. Yeah.
And we are still, we were just many of us were together during the holidays and a lot of close quarters, and you have a lot of illness.
That's the peak transmission season.
Yeah.
Right
Is that
there.
part of that echo that we see?
Yeah.
I know we went through, we certainly went through that with COVID, and we got very familiar.
Yeah. COVID's a really interesting case. As you mentioned, it's been low and it has stayed low all season long, which is great.
Yeah.
What we're probably seeing is one, that COVID's still trying to figure it out. If you want to, think of it as a thinking thing, which fortunately it's not. But we're trying to sort of figure out what it's going to do in the long haul.
Yeah.
Okay, it's become what we call endemic. It didn't just come once and go away. It right now is, I think, cycling with the other respiratory viruses. And what we're seeing is maybe this year people had more immunity to COVID than it did, say, to influenza.
And are the strains less virulent as they have been in the past? Or
that's really difficult to tell because of the reporting that we get. We're seeing fewer deaths with COVID. So that implies that perhaps it's not as severe. On the other hand, we also recognize COVID more quickly, and we know how to treat it.
Yeah.
So,
well, whether it's flu or COVID, we know that it's our older and our most vulnerable residents, right, who fall victim to this.
That's exactly right. Although we have seen a rise in teenagers with influenza as well. We don't necessarily we don't count everyone. We have two different things that we count. How many people were tested because they came in with a respiratory infection and tested for flu positive, and then how many hospitalizations. So there's a big group of people in the middle, like you and your family, who don't get tested. We don't know. Did you have flu? Did you? There are many other respiratory viruses out there just waiting to make you feel like crap during this season.
Well, I do want to point out we actually did have a COVID. We had a test that tested both for flu and for COVID.
Oh, you did? Yeah.
And my wife and I were both negative, so you know that. But still, it's interesting. They have these tests now you can take for multiple viruses.
Exactly. And that's what the physician offices do too. Some of them do the test that's just COVID and flu, and there's one that does COVID, RSV, respiratory syncytial virus, and flu. So that helps us a lot in numbers and in understanding what's going on in the community. But there are always a lot of people who are just kind of tough it out and don't go to the doctor, that sort of thing.
Well, we are seeing fewer people testing for COVID, obviously, and so, but we do rely still on our wastewater to sort of track the prevalence of COVID in our community. Is that still the case?
We have, and the wastewater numbers have stayed low too.
Okay, that's good.
And that's good. We like that when it correlates. There are a number of diseases where we now can test for them in the wastewater, but we don't really understand how wastewater reflects. But with COVID, because that was the first one we used, we're pretty confident that they mirror each other pretty well. Yeah. So it is. We've seen a little bouncing around, but it's remarkably low.
Okay. Yeah. Well, let me get back to prevention as we started this conversation. What is your advice on how people can protect themselves, whether it's RSV or flu or whatever it may be?
Yeah, obviously, I think I'm a big proponent of vaccination. I get my vaccines every year. At this point, because we still have so much influenza in the community, we're recommending that people who have a risk of more severe influenza, so people over the age of 65, if they have some sort of heart or lung disease, asthma, anything like that, and then the very elderly folks, if you're taking any kind of medication that suppresses your immune system, if arthritis medications are one category, that sort of thing, and then for just the general public, if you're worried about it, you can still get a booster shot. You can go in right now, and get a shot, and it will give you additional protection.
Okay.
And
for flu?
For flu.
Okay.
Yeah, absolutely.
Okay.
We do recommend that.
So even if you got one in the fall, go ahead and try it. Okay. Okay. And what about, I hesitate to even bring it up, but what about masking? It's become such a pejorative but it's
a strange thing. We've turned into a controversial topic.
I know, but anytime you travel at the airport, or especially in like Asia or places like that, everybody's wearing masks, and they've got it down even before COVID.
Japanese were ahead of us by decades.
Absolutely,
recognizing that.
But it makes sense.
It does, and especially you don't have to mask all the time, but if you're in an area where there's a lot of people standing around, and places like airports and places like airplanes. If the guy sitting next to you is coughing, that's a woman. That's a good time to maybe slip on a mask. Right. I do wear a mask when I travel.
That makes sense.
Because the risk is just higher. Just that many more people, and they work pretty well.
Yeah.
Little extra benefit.
Yeah, I know some people are kind of self-conscious about wearing masks sometimes, but I'll tell you, whenever I see somebody wearing a mask, I'm thinking, oh, that's a good idea. Maybe
Yeah,
I should be, whether I'm at a
yeah.
concert or on a plane or something.
Hmm.
At least it's good to carry one with you. You know, my wife
Always,
is
yeah.
always having this
Especially
carry
on
'em.
planes where you don't have a choice to move
Exactly. You never
if
know
somebody's
whom you might
coughing.
be seated next to,
Yes,
right?
exactly.
Yeah. Okay. Well, so we do suggest getting a booster.
Hmm.
Now, as I understand it, people can still go to pharmacies
Yep.
to get their flu shot. Of course, they can always go to their doctor
To
as
their
well,
doctor, right?
right?
The
But yeah, go
Yeah, the
ahead.
county's actually going to be having some free flu
Yeah, that's
clinics
why I'm setting
starting
you up to talk
tomorrow.
about
I
it.
knew. I sort of figured. Yeah, tomorrow, I think from 4 to 6, I believe is the time.
4 to 7.
4
I
to
have the
7. Oh,
9.
you have the
Yeah, I
actual
didn't wasn't going to
details.
stick you.
Okay.
It may come with the,
Thank
but we
you.
have you. The county has set up
Hmm.
free shots available at 4 clinics at Cafe Puente in Petaluma, which is at 601 East Washington Street, right?
Correct.
Yeah, and it's starting tomorrow, February 21st, from 4 to 7 p.m.,
Hmm.
followed by another clinic on Saturday, February 22nd, from 11:30 to 3. And then there's 2 in March, Tuesday, March 11th from 3:30 to 6:30,
Right.
and Saturday, March 15th from 11:30 a.m. to 3 p.m. So it looks like we have a good mix of weekends and weekdays there.
Right. And that was what we're trying to do. Make it easy in a place where people
Different times of the day.
gather
Yeah.
and different times of the day. And we may actually do additional flu clinics as we move through the flu season if levels remain high and there's a desire for people to have more
Yeah, that's
access.
fantastic. And
Yeah.
again, that's being sponsored through the County Department of Health Services. So
Correct.
do you need to make an appointment or can you
Nope.
show up?
Just show up. Everybody
And
who walks in can get a vaccine.
and the cost is
0 to
okay.
you.
Fantastic. And I need to ask this.
Hmm.
What kind of information do you take from people? There's a lot of concern right now as to are you going to ask me about my immigration status and all
Absolutely
that?
not.
Okay.
Absolutely not. What we do is give you information. We
Yeah,
give you a
good.
lot of information about the vaccine. We'll answer any questions that you may have about the vaccine. We don't take any personally identifying information. We have to record how many people
Right.
we vaccinate because we're responsible for demonstrating that we used the vaccines come from the government. So we have to be sure we're following those rules. It's anybody who comes in. We do not ask about your circumstances. We don't want to know your circumstances. We just want to know that you're not allergic to the
Yeah.
vaccine.
Good. Yeah.
That's
And
pretty
so a
much
little
it.
bit of history there might be
Mhm.
helpful.
And
Yeah.
your age. We do like to know people's ages
Sure.
because we want to be sure we're giving the right vaccines.
Yeah.
et cetera.
Similar to what we did in COVID.
Exactly.
So again, no appointment necessary. Just show up,
Mhm.
and there is no cost. Now, there's also been a lot of news reports about bird flu, and I'm wondering
Yes.
if you could help our listeners, some of whom were concerned about,
Yeah.
hey, can that affect me? Is there a risk from the bird flu? What's the difference between the flu and the bird flu?
Okay. So I'll start with what's the same.
Uh-huh.
Okay. They're both influenzas.
Okay.
Okay. And they're both, weirdly enough, an influenza A.
Mm-hmm.
You'll hear that sometimes, which is why I say that. But the human influenza A is one of the traditional flus that we see circulating.
Mhm.
Okay. The influenza that is the bird flu is a very different influenza.
Mm-hmm.
And it has been around for about 24 years.
Mm.
So it's not new,
Mm-hmm.
but it was exclusively in birds, wild birds.
Wild birds in
Yeah.
particular. Yeah.
And what it's done is as birds have migrated, and it's called a highly pathogenic avian influenza
Mhm.
because when it infects birds, it kills them.
Right.
And there's just nothing
There's
you
nothing
can do
you
about
do.
that.
Yeah.
And so because it kills them, it's interestingly enough been a bit slower to spread.
Mm-hmm.
But it has spread. And now when it came to the Pacific Flyway,
Mm-hmm.
that the migratory routes, that's why we started to see it. And then what happened is what we call a spillover event,
Mm.
where dairy cows in particular, and birds met each other,
Mhm.
basically.
Domestic.
Mhm,
Yeah.
domestic cows. And now the virus was able to mutate enough that it could infect the mammal, the cow.
Mm.
So we knew about the birds. We had a couple of backyard flocks and one commercial flock a couple of years ago
Mhm.
in Sonoma County. And then then it more mutated again. And what happens, influenza is actually a fascinating virus for
Mhm.
people like me. It has DNA like we have DNA, but
Mhm.
our DNA is neatly packaged up.
Mhm.
Theirs is in 8 little pieces.
Mm.
So when a virus gets into a cell, it spews out those 8 little pieces so that the cell will make more of the
Mm.
virus.
Mm.
They hijack the cell. If that cell is also infected by an avian flu and a human flu, they'll swap genes.
Mm.
And what comes out is a unique flu for which humans have no immunity.
Oh, interesting. Hmm.
So we actually have the whole human race has been exposed over many, many, many years
Right.
to many different influenza A's.
Right.
So we have this very low level of immunity. It's when a brand new one comes
Yeah.
that we get pandemics.
I see.
And
Okay.
that's what happened in 1918.
Right.
So the reason that we worry, there are two big things about avian influenza. One is that it's killing hundreds of millions of birds.
Yeah. Or
which-
we've had to.
or then it gets into the commercial flocks.
Right.
Because it's so pathogenic,
Mhm.
you have to kill all the birds.
You have to euthanize the whole
You have to
flock.
get the whole thing.
Yeah.
And that's devastating economically,
Right.
right? And it is also contributing significantly. It's probably the single largest contributor to the cost of eggs.
Yeah. And the rarity of them. I
And
can't
the
find them
rarity-
anymore.
It's
Yeah.
very difficult. With the cows, the situation's a little bit different. It's still a big hit economically, but fortunately, the cows don't die.
Mhm.
And we're still learning about cows because this is
Mhm.
pretty new. But there's very, very high amounts of the virus in the milk
Mm.
of the cow.
Mm.
So you still have to milk the cow every day because you can't leave a cow out
Right.
there not milked. But they have to throw that milk away
Mm.
because it has so much virus in
Mm.
it.
Mm.
And so their productivity goes down.
Yeah.
And when the cow is sick, which it is,
Mhm.
its productivity goes. So it's been a big hit to dairies where it's have. Now we've been really lucky in Sonoma County that none of the dairies in
No,
the
they
county
haven't been
we've
hit.
had we call them detections
Mhm.
because we don't test the individual cows.
Mhm.
What happens is that when the milk is gathered, it's put into silos. That milk, that aggregate milk on the farm,
Mhm.
is what's tested. And if we detect influenza in that milk,
Mhm.
then they can't. It's a dead stop
Oh,
for
right.
selling that
Yeah.
milk. That's how we're protecting people.
Is there a vaccine for the cows?
There are actually several vaccines going through testing
Mhm.
that are really, and there's one that's really promising. So I know at the federal level they're testing right now,
Mhm.
and it's there's also a vaccine for the poultry,
Mhm.
which I'm going to assume is that they eat it because I can't imagine how you
How
would.
you're going to
There
inject?
are hundreds of birds,
Yeah, it's not
thousands
gonna
of
work.
birds. That would be a problem. So I'm imagining it's probably inedible. But yeah, so I think they're very close to that,
Mhm.
and they have I think several strains of vaccine that they believe would also be suitable for humans.
Viable. Okay.
We have seen in the United States, we've detected about 68 cases of people becoming infected
Mhm.
with the bird flu.
Mhm.
It was actually the cow flu,
Mhm.
except in a couple of cases. However, all of those cases, with very rare exceptions, have been minor,
Minor. Okay.
and they're pretty much all. There's a few exceptions. Are in dairy workers because
Mhm.
dairy workers get a lot of splashing
Mm.
of milk, and so if it gets on your hands and you rub your eyes, it's really easy to get a virus from
Okay.
the environment.
Okay. But what I'm hearing is
Mhm.
overall the threat to humans is pretty low.
Very low.
Okay.
Very low.
Okay.
Yeah.
And are there still concerns you would give or advice you'd give somebody if they came across like a dead bird in the
Yeah.
what
Don't
would
touch it.
Don't touch it. Leave it alone.
Leave it alone. It's just the same thing we used to say about sick animals at the park
Yeah.
because of concerns about rabies.
Yeah.
You just in general, don't touch sick animals. You
Yeah.
can report them.
Yeah.
Animal control will go out and find them. Same thing is true about dead birds.
Yeah. Yeah.
Or
Good.
even sick birds.
Good advice. So let me. I wish we had more time to talk about this. I find it fascinating. But let me jump to the other one
Sure.
in our quademic here.
Hmm.
What about RSV?
Okay.
Who should get vaccinated
Right.
against RSV, and what is RSV?
RSV is a respiratory syncytial virus,
Mm-hmm.
and technically it's just a really, really intense virus. Now,
Mm-hmm.
most of us will get a cold.
Mm-hmm.
We'll feel horrible and wish we never, gotten
Yeah.
up.
Yeah.
But babies, very young babies under 6 months of age, are highly susceptible to
Mm.
RSV
Mm.
and can die.
Mm.
And people over the age of 76 as well.
Mm.
And so the people that we recommend vaccination for, so now babies under the age of 6 months can't be
Right.
vaccinated.
Yeah.
However, they do have a monoclonal antibody
Mm-hmm.
that can be given. For adults and teenagers and adults, we recommend the vaccine if you're over 76 years
Mm-hmm.
old,
Okay.
or if you're over 60 but you have heart or lung disease.
Some
And
history
it's
there.
a little
Yeah.
bit like who's most vulnerable, right?
Yeah.
And then beyond that's really the population that we save that vaccine for.
Okay. Okay.
So.
And can you test for it? I'm just gonna.
Yeah. Oh yeah, and this
Is that
as
one
I
of the?
said, there-
Is
it's
that
one
of
of the tests that are
Okay.
that's in the panel
Maybe I
that
even
some
tested
places
for
do.
it. Yeah.
You may have been. It's not in. It's still most places are testing for but if you go to an emergency department, they'll typically have a broader panel.
I'm just
they
curious.
test for.
How does it manifest itself? If I'm just sick and I'm
Mhm.
coughing, how do I know whether it's RSV or flu?
You
Or
don't.
you don't? You
You
just
don't.
they
Yeah.
feel the same.
They feel the same:
Okay.
fever, respiratory symptoms, headache, muscle aches.
Yeah.
It's kind of how your body. What you're feeling when you're sick with these viruses is your body fighting off the virus.
Yeah.
The fever is because your immune system's ramping up. The coughing is because your immune system's
Mhm.
putting fluid into your lungs. I mean, everything that you're feeling isn't really the bug, it's your body's reaction to the bug.
Yeah.
And
Yeah.
it's designed to help you clear the bug.
Yeah. And the best
But it
thing you can do
sucks.
is just stay home and
Yeah.
have
Please
some
do
tea.
stay home and not
Yeah.
share. We
Yeah.
don't. This is something we don't share.
Yeah. Yeah.
Is respiratory. Tea's great, actually.
Yeah.
Especially
good to know.
if you put a little honey in it, it's very
Mhm.
soothing. Not a high caffeine tea. Don't recommend that.
Right.
Your heart's already working hard.
Yeah. My wife always knows when I'm not feeling well because I start drinking tea.
There
Also,
you
if
go.
she sees me drinking tea, are you feeling okay? Are you all right? Well, so-
But I will say staying hydrated is
Yeah.
really important when you're sick because your body needs that fluid. You're losing fluid through sweating
Absolutely.
and yeah, some people will just, I can't sit. You've got to
just
yeah,
some
tough
water.
it out.
Just tough it out.
Yeah,
Have
tough it
some
out and have
sun.
some water.
Anything else you want to share with our listeners? We're kind of need to wrap up, but anything else you want to share about what's going on the health front these days?
No, I'm going to give you a little number game
Yeah.
here. Okay. So in the United States, the government overall, state, local, feds, put about $250 per person per year into the public health system.
Mm-hmm.
Okay. Compare that to the $10,000 per person per year that we put into the healthcare system,
Hmm.
your doctors, your clinics, your
Mhm.
hospitals, your nursing
Mhm.
homes. That's what we put much less into prevention.
Yeah.
And the return on investment for every dollar in public health is a little over $14.
Yeah.
So it's a good deal.
Yeah.
I'll
It's
just
a payoff.
It's a payoff, exactly.
I was reading something like 80% of our healthcare costs in this nation are at the end of life care.
That's correct.
So if we put some of that money toward prevention, how much better off would we be?
Exactly.
Well,
Yeah.
I'm an advocate. Okay. Well, listen, thank you so much for being here.
It's been a pleasure.
We'd love to have you back, have check-ins every now and then. Fortunately, we're not like the days of COVID when we used to do these health updates 3 or 4 days a week
yeah.
back in those
Yeah.
crazy days.
Trying
So,
to keep track of what's going on.
yeah,
right?
but we would love to have you back. We
Thank
really
you.
appreciate you being here. And as a thank you, we'd like to give you one of your SoCo Chat coffee mug to take
Love
with
it.
you. And to our listeners, we too would like you to give you a chance to win one of our SoCo Chat coffee mugs, and as well as a gift card to Pete's Coffee to go get your cup of tea if you're not feeling well. All you need to do is give us a correct answer to our trivia question today, and we will include you. Our question today is, what year was the influenza vaccine first developed? Was it 1925, 1931, or 1937? If you know, call in right now at 565-2242 or email us at publicaffairs@sonoma-county.org. And if you're the first to call or write in with the correct answer, you will receive one of those mugs and the gift card to Pete's Coffee. Also, if you have comments about this or any other segment or have a suggestion for a topic for a future SoCo Chat discussion, please, we'd love to hear from you. Email us at that same address, publicaffairs@sonoma-county.org. Thank you all, and we hope you continue to follow us on Spotify, Apple Music, Amazon, and YouTube. We'll see you next time, and stay healthy. Thank you, Dr. Smith.
My pleasure. Thank you.